If you take amlodipine, losartan, or lisinopril every morning with your coffee, here's a question worth sitting with. How much of what you've quietly written off as just getting older over the past few years might actually be your medication talking, not your age? These three are among the most commonly prescribed blood pressure medications in the country, and they work genuinely. They lower blood pressure and reduce stroke and heart attack risk, and nothing in this video is a reason to stop taking them. But each one comes with a specific set of side effects that show up slowly, gradually, and look almost exactly like normal aging, which means they get explained away for years instead of mentioned to a doctor who could often fix them with a simple adjustment. A quick note before we go further: this channel is for general education, not medical advice, and we're not your doctor. Never stop, skip, or change the dose of any blood pressure medication on your own doing that can be genuinely dangerous. What we're walking through today is simply the why behind 7 specific effects, so you can bring the right questions to your own doctor instead of quietly assuming there's nothing to be done. Stick with us to the end, because the 7th one is the one doctors say gets mentioned least, even though it's often the easiest one to fix. Before we go further, tell us your age and what state you're watching from in the comments. We read every one, and it shapes what we cover next. Here's the piece almost nobody explains clearly. These 3 drugs are not the same kind of drug, even though they often get lumped together simply because they're all blood pressure medication. Amlodipine is a calcium channel blocker. It works by relaxing and widening blood vessels, making it physically easier for blood to move through. Losartan and lisinopril work on a completely different system, one that regulates fluid and salt balance in the body. Losartan blocks a hormone called angiotensin from doing its job, while lisinopril stops that same hormone from being made in the first place from a slightly different angle. Picture blood pressure control like managing water pressure in a house. Amlodipine widens the pipes. Losartan and lisinopril adjust how much water the system is holding onto in the first place. Because they work through different mechanisms, they also produce different side effects, which is exactly why this list is organized by drug, not treated as one generic warning label. Number 7, and the one doctors say gets mentioned least, is a persistent, dry, tickly cough specifically tied to lisinopril and other drugs in its class, called ACE inhibitors. Here's the mechanism. Lisinopril's method of lowering blood pressure also causes a buildup of a substance called bradykinin in the lungs and airways. And in a meaningful percentage of people, research places it somewhere between 5 and 20% of those taking ACE inhibitors. That buildup irritates the airway enough to trigger a chronic, dry cough with no mucus, no cold, no obvious cause. It often starts weeks or even months after beginning the medication, which is exactly why people rarely connect it back to a pill they've already been taking a while, and instead chalk it up to allergies, aging lungs, or just a cough that won't quit. Here's the important safety line, worth stating clearly and stating it once now, because it applies to everything on this list. Never stop lisinopril on your own because of a cough. This is genuinely a nuisance, not an emergency. And it's easily solved in most cases. A doctor can simply switch you from lisinopril to losartan, which works on a related pathway without triggering the same bradykinin buildup, and the cough typically resolves within days to a few weeks of the switch. Number 6 is swelling in the ankles and feet, specifically tied to amlodipine, and this is one of the most common effects on this entire list. Here's the mechanism. Amlodipine relaxes blood vessels throughout the body, but it relaxes the small arteries more than it relaxes the veins that carry blood back up from your legs. And that imbalance lets fluids seep out of the smaller vessels into the surrounding tissue in your lower legs and feet, especially by the end of the day. Consider a woman in her late 60s. Call her Donna, who'd noticed her ankles were puffier by evening and her shoes fit tighter than they used to, and simply assumed it was normal circulation slowing down with age, the way it does for a lot of people. When she mentioned it at a routine visit, her doctor recognized the pattern immediately as a known amlodipine effect, not a new circulation problem, and adjusting her dose slightly, along with a recommendation to elevate her feet in the evening, noticeably reduced the swelling within a couple of weeks. The line between nuisance and something to flag urgently. Mild evening ankle puffiness that goes down overnight is common and usually not dangerous. Sudden swelling in one leg only, especially with pain, warmth, or redness, is different and worth calling your doctor about promptly, since that pattern can signal something else entirely, like a blood clot, unrelated to the medication itself. Number 5 is dizziness or lightheadedness, especially when standing up quickly from sitting or lying down, something doctors call orthostatic hypotension. And it can happen with any of the three, though it's most pronounced with amlodipine and lisinopril, especially in the first few weeks after starting or after a dose increase. Here's the mechanism. All three medications lower blood pressure by design, and when you stand up suddenly, gravity pulls blood toward your legs for a moment before your body's normal reflexes compensate and push it back up to your brain. In someone whose blood pressure is already being lowered by medication, that brief compensatory lag can be enough to cause a real head rush, sometimes severe enough to cause a stumble or a fall. This one matters enormously for seniors specifically, because a fall from dizziness is a far more serious risk at 70 than it was at 40. The safe action here is simple and worth adopting as a habit, regardless of whether you've noticed symptoms yet. Rise slowly. Pause seated on the edge of the bed for a moment before standing, and hold on to something sturdy for the first few steps, especially first thing in the morning. Number 4, tied specifically to losartan and lisinopril, is fatigue and a kind of mental fog that's easy to mistake for ordinary tiredness or just getting older. Here's the mechanism. Both drugs work by lowering blood pressure through the renin-angiotensin system, and in some people, especially when blood pressure drops a bit lower than the body is fully adjusted to, blood flow to the brain can be modestly reduced compared to what it was used to, which some patients experience as a subtle, persistent mental fog or low energy rather than dramatic dizziness. This effect tends to be most noticeable in the first several weeks after starting the medication or after a dose increase. And for many people, it genuinely does settle down as the body adjusts. But for some, it persists, and it's worth mentioning specifically as fog, since starting or increasing this medication rather than a vague, "I've been more tired lately." Because that specific framing gives your doctor something concrete to work with. Number 3, specific to losartan and lisinopril, is elevated potassium levels in the blood, called hyperkalemia. And this is the one on this list that's genuinely worth taking seriously rather than shrugging off as a minor nuisance. Here's the mechanism. Both drugs work by interfering with a hormone system that, among other things, normally helps the kidneys excrete excess potassium, and blocking part of that system can cause potassium to build up gradually in the bloodstream over time, especially in people who also take potassium supplements, use salt substitutes made with potassium chloride, or have any degree of reduced kidney function. Mild elevation often causes no symptoms at all, which is exactly why routine blood tests are typically ordered periodically for anyone on these medications. This isn't something you're expected to catch yourself. More significant elevation can cause muscle weakness, an irregular heartbeat, or in serious cases, a dangerous heart rhythm disturbance. The safe action is straightforward. Keep up with the periodic blood tests your doctor orders while you're on these medications, and mention it specifically if you've started using a salt substitute at home, since many are potassium-based and people rarely think to bring that up. Number 2, tied to lisinopril and losartan both, is a change in kidney function markers on routine blood work, not a symptom you'd feel directly, but something that shows up as a shift in creatinine or eGFR numbers on a lab panel, and it's often misread by patients as "my kidneys are just declining with age," when it may actually be a medication effect worth a specific conversation. Here's the mechanism. These medications work in part by relaxing the blood vessels feeding the kidney's filtering units, which is protective for the kidneys over the long run in most people, especially those with diabetes. But it can cause a modest expected shift in kidney function numbers when the medication is first started or the dose is increased, usually stable and not concerning, but occasionally more pronounced, especially in someone who's also dehydrated, on a diuretic, or has underlying kidney disease. This is exactly why doctors typically order a follow-up blood test a few weeks after starting or adjusting these medications. And it's worth asking directly, did my kidney numbers change since starting this? And is that expected or something to watch? And here is number 1, tied specifically to lisinopril, and it's the one true emergency on this entire list, worth knowing cold. A sudden, rare but serious reaction called angioedema, swelling of the lips, tongue, throat, or face, sometimes appearing suddenly, even in people who've taken the medication safely for years without any problem. Here's the mechanism. It's connected to that same bradykinin buildup responsible for the ACE inhibitor cough, but in a small percentage of people. That buildup triggers a more dramatic swelling reaction in the deeper tissue of the face and airway rather than just the lungs. This is genuinely rare, but it is a true medical emergency when it happens, because throat swelling can compromise breathing quickly. The line here is not nuance, it's absolute. Any sudden swelling of the lips, tongue, throat, or face, or any sudden difficulty breathing or swallowing in anyone taking lisinopril or any ACE inhibitor means calling 911 immediately, not waiting to see if it gets better, and not driving yourself anywhere. This is rare enough that it shouldn't cause anyone to fear a medication that's working well for them, but it's exactly the kind of thing every household with an ACE inhibitor in the medicine cabinet should recognize instantly if it ever happens. So here's why all 7 of these matter as a group rather than 7 separate warnings. These medications are not rescue drugs you take. Only when you feel bad, they're working quietly every single day, whether you notice anything or not. And that means their side effects also arrive quietly, often disguised as things people expect from getting older anyway. Tiredness, dizziness, ankle swelling, a nagging cough. Every one of those has a dozen other possible causes, which is exactly why they're so easy to write off as age instead of medication. The doctrine that ties this whole list together. Nothing here is a reason to stop or change your medication on your own. These drugs are protecting your heart and your brain from real, serious risk. It is every reason to bring a specific, named symptom to your next appointment instead of quietly living with something that might be a simple, safe adjustment away from resolving. Tonight's plan, in one sentence, think back over the past year. Has anything on this list crept in gradually since you started or adjusted one of these 3 medications? And if so, write it down and bring that specific list to your next visit. Before you go, which of these 7, if any, sounded familiar? Tell us below. Your answer might be exactly what nudges someone else to bring it up instead of explaining it away. And if this explains something your own doctor never had the 10 minutes to walk through, send it to someone in your life on one of these 3 medications. It costs nothing, and it might be the reason a simple fix finally happens. One more thing before we close, because it matters more than anything else in this video. Never stop or change the dose of amlodipine, losartan, or lisinopril on your own. For any reason, these medications are protecting you from real cardiovascular risk, and any adjustment needs to happen with your doctor. And know the one true emergency on this list: cold, sudden swelling of the face, lips, tongue, or throat, or trouble breathing, means calling 911 immediately. We've covered what these 3 medications can cause, but there's a specific time of day when taking them actually changes how well they work, and almost nobody's doctor has time to mention it, and that's exactly what we're covering next. Watch that one right after this.